are at risk for colon cancer. So let's put our first slide up on risk factors. And then I'll have Dr. Samir talk a little bit about that. All right.
Okay, so risk factors for colon cancer, obviously age. As we grow older, we tend to develop colon cancer. A majority of the colon cancer, more than 85 to 90% of the colon cancer develop after age 50. So age is one risk factor. Then we have some other risk factors like consumption of meat, red meat, sedentary lifestyle, smoking, excessive alcohol consumption, obesity, insulin resistance, which is diabetes, and obviously if somebody has family history of colon cancer or personal family history of colon polyps, they're at increased risk.
I'm so happy that you began with modifiable risk factor. So apart from age, the first four factors you mentioned, they are modifiable. You did say consumption of meat, red meat.
Red meat.
You did say obesity. You did say diabetes. Smoking and inactivity. Can you imagine that all these are risk factors for colon cancer? Not only colon cancer, but all type cancers. So as you listen to us, as you listen to the show, Get Healthy with Dr. Cooper, you'll realize that there are many diseases that you can actually prevent using lifestyle modifications. Exactly. All right, let's move to the next slide. Let's look at some of the symptoms. And you did mention that sometimes there might be zero symptom.
Exactly. This is the key point. Actually, this is my message to my audience that colon cancer in the early stages is symptom-free. It does not have any symptoms. However, when the symptoms started to occur, usually it is too late. That's why it is important that look for those symptoms very carefully. The symptoms are abdominal pain, significant progressive constipation, which is not getting better, bleeding of any sort. If you notice blood from the rectum, this is a red flag, is a warning symptom. Don't ignore it. If diarrhea, weight loss, fatigue, iron deficiency, anemia, that's why you feel fatigued and tired all the time. So change in bowel habits, meaning you were having constipation, now you're having diarrhea, or vice versa. I mean, all those things are potential.
What about pencil-like stool?
Yeah, I mean, this is also, though it's not specific, but it is seen in any kind of obstruction. If there is an obstruction, then it can be a pencil, thin-shaped stool, which Dr. Cooper just mentioned. And these are important symptoms that we really need to look into it.
Right, and as you scope your patients, we're going to look at what the actual picture would inside, be inside. Yes. All right, so let's go to the next slide.
Sure.
All right, there we go.
Yeah, here you can see that this is the colon lumen inside. We are actually inside of the colon, and here you can see is a polyp right there. And this is obviously a growth from the wall of the colon, as I was mentioning earlier in the beginning of our talk, that this is the precursor for colon cancer. So it does not belong here, it has to be out. And we can definitely take care of it during this exam. And here, as you can see, there is a snare going around this polyp, and this is my snare. You can cut it and take this polyp out. And by taking this polyp out, you're preventing colon cancer.
There you go. Let's see the other slide.
And here you can see this is a difficult, as I told you earlier, that my area of interest is difficult colons, where technically they're difficult to remove. So here you can see it's a kind of a flat polyp, though it's not large. We can remove even much larger polyp than this, but technically this is difficult to remove, and sometimes it is difficult to be detected as well because they tend to be very flat. So we have different ways to handle this kind of problem, and what we do is that we inject to raise this polyp so that we can remove it. So this is called flat polyp.
That's right. Any other slide there? There you go.
And this is something which we all don't like to see. Here you can see that this is ugly kind of lesion. there's a lot of thickness, and the mucosa looks abnormal, and here you can see a mass which is covering the entire lumen of the colon. This is a colon cancer. Sometimes we can, instead of having a large lesion, you can see a small portion of the colon. This is also looks like a cancer. You biopsy it during colonoscopy, that will give you the diagnosis. Same thing here. You can see a large mass inside the colon, which is obvious colon cancer.
Right, right. On the show today, we're not going to discuss treatment except removal of the lesion.
Yes.
One of the ways in which we can actually surgically treat this cancer is removing part of the colon.
Yes, exactly. So once you have anybody has a diagnosis of colon cancer, that does not mean that it is like a death certificate.
No.
Or no, that's not the case. We do definitely have treatment available. However, it entirely depends on what stage you're diagnosing the disease. If it is early stage, there are 4 stages of colon cancer. We call it as, you can call it stage 1, 2, 3 and 4. So up to stage 2, just the surgical resection is good enough. However, when there is any involvement of the lymph nodes, which you can only tell after surgery, if there is any involvement, then besides the surgical removal of the cancer, you also need chemotherapy. However, the 4th stage is a stage where the colon cancer has spread to the other areas of the body, especially the liver. That is the type of or stage of the cancer where we cannot treat the patient with the curative intent, meaning that this disease at this point is not curable. However, we have chemotherapy available that can definitely control the disease.
Very good. Doctor, I want to thank you so much for being on the show
You're welcome.
today.
It's my pleasure.
And this is not a death sentence guide. I want you to realize that you can actually prevent cancer using lifestyle modification. So I'm going to take a short break.